Hi, good day, everyone. My name is Lavin Mahotra. I'm a for medical student, and today I will be discussing my ethical case. So, my ethical case will highlight ethical issues such as medical negligence, non disclosure, and professional accountability. So, first, I will start by discussing the case actual background. So, the case involves Mr. AP, a 70-year-old male who presented to the public health center complaining of numbness in the legs and difficulty walking for the past 3 months. Now, Mr. AP had suffered a stroke 8 years ago, which left him with some significant cognitive impairments, as well as he suffers from hypertension for the past 20 years, which he's managed on an allopril. So, upon further discussion, Mr. AP's sister, who was with him, who accompanied him um, to the visit, expressed that Mr. AP first started experiencing these symptoms 3 months ago, after which they went to their general practitioner, private general practitioner, who followed up on his symptoms and ordered a brain CT scan, considering that Mr. AP had a stroke in the past. And upon getting those results, he reassured them that everything was fine and no treatment or referral was needed. Now, after they visited the private general practitioner and they got that response, 2 months later, his symptoms just kept on getting worse. So they decided to come to the public health center. So upon reviewing the report copy, when the doctor reviewed the report's copy, the report showed that Mr. AP actually had an aneurysm that he suffered from. So the doctor was very shocked to learn that not only did the private practitioner fail to disclose the condition to Mr. AP, but he also reassured them that everything is fine. So the doctor immediately referred referred Mr. AP to the hospital. She wrote a referral letter, so he can be seen by the hospital staff, and they will take the appropriate steps moving forward. Now, even though the doctor realized that the private general practitioner did the right thing, the doctor chose not to report him. So nothing was done to further that. So ethical issues that were identified in the scenario. So number one was medical negligence and non-disclosure. So this was done by the private general practitioner where he failed to do his duty of care by withholding a life-threatening diagnosis, delaying necessary treatment. Second was autonomy and informed consent, where that every patient has a right to know their diagnosis and to make informed decisions. Even though Mr. AP had a cognitive impairment, the doctor should have informed the next of kin or responsible caregiver of the serious diagnosis. So the third one would be professional accountability. The clinic doctor recognized the private general practitioner's negligence, but the doctor failed to report it, potentially putting other patients at risk. So, lastly, justice and patient safety. So, this 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 whole scenario puts not only Mr. AP at risk but other patients as well. So, if the general practitioner is not reported for his misconduct, more patients are at risk because of improper healthcare management. And as we know that unethical behavior leads to a deteriorating trust in healthcare. Now, how did this impact Mr. AP? So, the failure of the private general practitioner to disclose the aneurysm that could have had serious consequences for Mr. AP by withholding that critical health information, he put Mr. AP in a very bad situation where, due to delayed intervention, his condition may have gotten worse. So this will and he's already suffering from congenital impairment. So this will um, be affecting him both physically mentally and emotionally. And so and his trust in medical healthcare, as well as his family's trust, that when they carry him by the doctor and they go with their full belief that the doctor will help them, that's not there anymore. Now, how did this affect me as a fourth year medical student? So this case showed me the importance that we play as medical health professionals, um, in a patient's life. So it re-emphasized the fact that it's not only about watching somebody, their symptoms, diagnosing everything, confidentiality, disclosing information to patients, patient autonomy, their rights. They play equally as an equally important aspect in healthcare as diagnosis and the correct treatment play. So that is how this impacted me. What could have been some things that we can do in the future to what are some things that can be done in the future to improve the situation? Is that so some of the things that was done, that the health the public health doctor did assist Mr. AP in getting immediate treatment. So the referral was made immediately on that day, so no delays were there. So that's one, that we supposed to give immediate referrals regardless if we are um, public health practitioners or private health practitioners. So guidelines could be made about these things, and they should be sent out. They could be sent out, re-emphasizing the fact that even that how important of a role this plays in management of a patient. Now, one other thing could have been done is that the private GP should have been reported. That should have been a moral duty of the health public health doctor. That big, so this would prevent from putting further patients into danger if the doctor continues to conduct himself the way that he is. And informed decision making should also be made. So if a person is suffering from cognitive impairment, all important details should be shared with the guardian or next of kin, and legal and disciplinary actions should be more firm, that in the sense that action should be taken when somebody fails to disclose a life threatening condition, such as in this case the general practitioner did. So this case is a clear example of how ethical lapses can have serious consequences. While public clinic doctor acted in Mr. AP's best interest, the doctor's failure to report the GPs represented a missed opportunity to prevent further harm to other patients. As future healthcare professionals, we must uphold transparency, accountability, and patient well being. Ethical medical practice demands that we not only treat patients properly but also address and report misconduct when we witness it. So, this concludes my presentation. Thank you so much for the attention.